gentlemen, we are live today, and this is the 8th of October 2020. We're counting down towards Christmas. We're counting down to the time where we get rid of COVID. COVID is gone. We're strong, we're positive. Who is the man that says that? Well, tonight we're going to talk about Trump. Tonight we're going to talk about there's a bank in the UK from Jamaica who actually turned to be a commercial bank, Jamaica National. That is something, I don't have much information on that, but that is some big news, apparently, some big announcement today. And also, as well, the government is going to start doing these daily briefings. And on top of that, we're going to talk about Black history. Did you know? Did you know? Before I go any further, I'm going to introduce my panel and team today, which is Dr. David Burton, Keisha Allen, and Keima. How are you guys?
All good, Silbon. All good. Can you hear me?
Doing great.
We can hear you. We can hear you.
Fantastic.
Keisha, can I hear you?
Yes. Hi, everyone.
David, Keima, good. How's the week so far? Another week.
Yes, it seems as it has flown by this week.
It's flown
I
by.
can't believe it's Thursday already.
Wow. Did you go to the office?
This is the office.
I'm just checking to see if anything has changed. Keima, did you go into the office today as well?
Well, I continue to work in go on the site, so I'm one of the very few that goes into the office regularly.
Yeah.
Unlike so many of other people, we are trying to listen to the government and take the government's advice, and so most of our staff are working from home. Only I wouldn't say essential, but staff that really needs to be on site actually go on site.
And David, you went into the office as well?
I'm always in the office, Silbon. The only thing that's different is how I get to the office. So I hope to share with you some information in regards to some sponsorship that I'm looking for Prostate Cancer UK. So I've been running to the office and running back from the office.
Wow,
I'm running to Mini Man's office. So yeah, I'm trying to boost the miles.
Well, health is
keep fit. Yeah, in the face of forces.
Yeah, health is something very important. As me, I've always been in the office from we lockdown, before we lockdown, still we lockdown. Just carry on as usual and try to be safe, But David, I think as usual, somehow we always have to start
with the geezer.
Yeah, we have to start with that geezer. I mean, somebody just messaged me a while ago, and I hope she comes on, talking about that in Birmingham, they are knocking on doors. Soldiers are knocking on doors, asking people to do testing. But we come to that later. But the latest thing which we have been seeing is that they're going to start doing these daily briefing. The government is going to get back on that. But what's the latest thing with COVID, that geezer? The Chinese flu, if Chinese things.
So that's your words, not mine, by the way. In regards to the newest update, I think there's whisperings that there's going to be a new sort of simplification of the system to allow local lockdowns to occur. So more of a traffic light system, red, amber, green. And that's really just to show what the alert levels are. So level 1, 2, and 3. And essentially starting with red meaning that, we'd have to stay indoors and not socialize. Amber meaning that and it's speculated here that we would be able to socialize, but in very smaller groups, and green being able to socialize. So these are the whisperings that are coming out, and it's just to try and give a bit more simplicity to the idea of what a local lockdown measure means. So if you're in an area that is a level 1, for example, you would adhere to the policies that adhere to level 1. So those are that's the new kind of discussion that's taking place at the moment in regards to government. And this is again, we've talked about this local lockdown measures. It does seem, however, that what I will say is that it does seem that sort of these measures are employed for places in the north of England. I do wonder what's happening in the south of England in regards to the R number and the infectivity rate. We've seen that the highest number of cases today in a region of around 17,000 cases, with 77 unfortunate loss of souls. So these are the numbers that we're working with. We're finding that fortunately the number of people who are passing away is small, but significant nonetheless. So we just have to watch this space.
Just touching on that one there, Keisha. I know your position in regards to this, but do you believe that somehow, because of the death, not so much, not that we want the death, but yes, there's an increase of persons who are actually having COVID. Is it saying that somehow we are by staying in, we are not really experiencing how we're going to go forward. I mean, I go back and think a bit, but what do you think about that, Keisha?
By staying in, Silburn, what you're doing, you're staying safe, and also what you're doing, you're keeping. But the most important thing is actually the health of the nation, as I keep saying, and therefore that is the priority. So it's not. I don't understand what is the rush to open up and to act as if things are normal when we still have a crisis at hand. There's still threats about closing down certain areas within the UK, and so on for that basis, I think that in order to contain the virus, we really need to start, stay put. Tell people to stop the moving, and that is not somehow being heard, and that is the reason why I believe that people like myself who are staying at home and getting on with work, as in working from home, are doing a great deal for this for the country. People who are going about working mixed in and so on are actually the ones who are potentially causing the increase in the virus. Especially if they have it. Recently we heard of one politician who actually had the audacity to travel on the train to the parliament, or travel on the train knowing that she was COVID positive. The audacity to do that, to be moving about, and these are the things that is actually causing a great concern to myself, because what is happening is that because she is not obeying the rules, or because she's not doing the simple social distancing measure, which is to stay at home, stay away from people for the time being. This is what's causing the increase in the virus.
Mm-hmm. Keima, what's your take on what, based on what's going on regarding COVID?
Well, I mean, it's for me. You look at the number of universities. North Newcastle being one of them, the latest university that's I think over 1,000 students has been found to be tested positive of the COVID virus recently, and a lot of the countries in a lot of parts of Northwest and Northeast in particular are those areas that are now seen to be very much the hotspot. But those, a lot of them are university towns, which tells you the opening of universities and a number of students going back with Freshers' Weeks and the partying on the weekends as just before the midnight, the 10 o'clock curfew hasn't really helped. And I think some of these measures that the government are trying to put in place to really curb the virus is really doing the opposite, because people are trying to almost last minute get the party in the last minute. So that's, I think, as a result of it. But also the government's also doing a lot of other things as well, trying to curb the virus, i.e. there's a number of other countries now that's been put onto the quarantine list. So and now it's making it illegal now. So if you travel abroad, when you come back, you need to tell your employer where you've traveled to. And if you don't, if you carry on working and you don't quarantine, you could have you're subject to a substantial fine, somewhere between 1,000 to 10,000 fines. So the government are doing a lot of these measures, trying to get people to take this very, very seriously, whether people are doing that or whether people are just bored of the whole COVID thing. And I think a lot of people are actually switched off. I don't think a lot of people are paying attention anymore because they don't know who to listen to or what to listen to anymore. And I think that's the risk when we come to this point now where you don't really have people engaged. It makes things, it doesn't really help in terms of getting your message across.
Well, David, listen, there are 17,540 new cases of COVID recorded in the UK on Thursday, and up from the 14,162 reported the day before. Government data showed, and a further 77 people died after testing positive for the virus within 21 days. I mean, at this rate of how things are going, I mean, it's just like what Jamaica says. Jamaica government is actually saying everybody's just treat everybody as if they're going to have COVID. I mean, you know, what's the way forward, really? I mean,
Yeah, what is the way forward? I think I think I've already said on this platform that the way forward is a balancing act. It's a tiptoeing. It's trying to work out what measures will help and what measures will not help in trying to balance people's health as well as people's mental well-being against getting back to seeing people, communicating, and not being trapped indoors, so to speak. So there is this tiptoeing and fine balance that needs to be to place. I'm not here to say that we should all be indoors, but at the same time we should not all be mixing and socializing. I think that there has to be that balance, because we cannot live in hibernation for a prolonged period of time. What we have to do is act safely, respect rules, respect people's sort of distances, wear face masks where required, and take things sensibly. I do think that the fatigue is a big element. I do think the mixed messaging doesn't particularly help, but at the same time, we've got to use our common sense when it comes to battling viruses. We've done that before. This is not unique from a virus point of view, in the sense that we've known that viruses have existed since day dot. But we just need to adopt a manner that's sensible to approach this particular virus in itself. And to get a uniformed approach to that is very challenging and very difficult. But I think if we have a simple message, it will hit home and get through.
Not moving away from the topic, but within the same sphere of things. I mean, Donald Trump recently had COVID. Well, he had COVID. Well, COVID or not. But he's been talking about this vaccine, which or something which he has been using. I know Kamala said, "I'll listen to what the doctor says, but anything from Trump, I'm not going to take it." You know what I mean?
So
he's using something.
Let me just say two things on that. I know, so you're going to make a point, but it's not a vaccine that he's using; it's treatment. So this is the thing that we know is basically developing. We know that the treatments for this particular strain of virus are evolving. We know that we're able to combat it a heck of a lot more effectively now than we could do at the very onset of this pandemic, and that's because we've just learned through trials. We've been able to use medication that has been effective to try and quell and quash the effects of the virus itself. So that's the first thing. But the second thing that you just talked about there, which is the implications of a vaccination, is quite true. Obviously, if a vaccination is safe and effective and being deemed so, then that could be used world over. However, my cautionary tale here is that we shouldn't just rely on that as a go-to, because I don't think it's going to be a silver bullet. I don't think it's going to change the way that we interact wholesale, and that we have to really deal with this for the long term.
It's interesting just listening to what you said, and there's a Nordy Mackenzie. Good evening, Nordy, and good evening to persons who are on Facebook and YouTube. She said, "Why should we pay attention when a lot of people that have been hyped, when people's mental health are being pushed to the limit, when mental health services are being stretched to the limit, and the service can't cope?" What she said is a mouthful right there. It is more like saying, why should we pay attention? But what I'm getting from her is like there's a frustration as to who is really telling us what to really do. So there's a lot of frustration and a lot of mental health factors there. I mean, what do you say about that, guys? The mental health.
Yeah, I mean, I can't say enough. She makes a very good point, and that's essentially what I've been trying to say in this forum, is that we can't just think about COVID alone. We've got to think about people's health and well-being, and that's why I say we can't just live in hibernation. You've got to have that element of communication. I sound like a broken record, but I'll just keep saying that. It's the balance between the two that we need to really get to, because I think that a lot of the work that we've put into COVID has really looked at the direct consequences and what that means for people in regards to picking up the virus. But a lot of what has been lost is the effect on mental health, well-being, but also other health conditions, stroke, heart attack, all the conditions that you can think of, cancer. Those things have kind of fallen by the wayside. I think we're increasingly starting to pick those up as conditions that actually are still in circulation and will continue to be in circulation. And we need to make sure that people are empowered enough to go into hospitals to seek medical attention where necessary, and not feel that they should live in fear from this virus.
I put it to Keima, and Keima, that point clearly is said right there about the hibernation thing. And I know you're speaking from your perspective, but at the same time, the isolation. Don't you think that isolation can be also a part of the health, the factor which contribute to bad health?
Yes, and that's one of the issues, and that's one of the things I've said before, that I think is very important, that there's some people, particular people who live on their own, they don't have that sort of interaction as usual. So going into the workplace does help, and where the government is encouraging people who can work from home to stay and stay and work from home, I don't think is really good in terms of individuals' mental health, because it's very, very important to have that interaction. So I think individual will have to try and probably do some other social activities, which involve social distancing to some extent, whether it's exercise or going out for walk, fresh air, to walking the dogs or things like that. They would have to do that in order to maintain their mental health. But this is going to go on for some time. Boris had actually mentioned possible another 6 months. I mean, we've spent previously almost 6 months already indoors, and so going on for a very long period of time is not going to be helpful for individuals' mental health. But not only that, in terms of the measures are actually saying, I think we're also part of England now, that you can't really mix with other households. So if you are grandparents or your older relatives live on their own, it makes it absolutely more difficult for young people to meet. And that's not very helpful in terms of individuals' mental health in itself. So I think it's going to be much harder. People are going to have to try and find other ways to interact. A lot of the ways is virtual, but I don't know how many times or how long you can stay in front of a computer and talk on the phone and, to your friends and family. But people are going to have to try in order to do these sort of things so that they could actually look after their own mental health.
Keisha, that's a good point, isn't it? Well, Keisha, go ahead.
I don't know. I think I might have misunderstood what Keima and David is saying here. It appears that they're saying that because you're staying at home, this could lead to mental health breakdown. I mean, let me put it to both of you. The fact is, mental health, when it comes to mental health, there's so many different factors that causes mental health. Not because people decide to stay at home to save their life and to stay away from people who may actually have the risk of the virus. It's actually contributing to people breakdown in mental health. That it's a wide range in issues. You have issues with there's money issues, housing, work issue. Some people actually being told that they're being made redundant. Some of them actually have different type of background, alcoholism, smoking, whatever it might be, that actually contribute to this mental health. So let us not be mistaken that because you are asked to isolate or stay at home, that this is causing mental health. I think mental health is a huge issue, and we need to actually explore all different factors. The bottom line is the government knew from the outset, when they started this, when the whole COVID pandemic started, they knew that mental health issue may be a concern for different reasons. And unfortunately, although we heard about getting life coaches involved and all this examples of what needs to be done, we haven't had this conversation from the government. Personally, I haven't heard it, and I think it's a matter for the government to actually bring forward what they're going to do to help people who are struggling with all type of issues that could actually result to or affect their mental health. That is exactly what we need to be looking at, rather than assuming that the people are losing their minds or actually experiencing have mental health issues because they're actually staying at home. I think it's bigger than just staying at home.
Well,
but where you have to understand, Keisha, is the interaction. It helps people to be able to talk to somebody else in confidence. If they're particularly with this is an extremely very difficult time, and I think by the end of this month it's going to be so much worse, because we already heard about some companies who are projected to lose a lot of job redundancies, some big name companies, and it's going to get worse by the end of the month. And people, particularly those who are going through that financial struggle, because a lot of them will, on top of the fact if a lot of them can't meet and interact with their friends and family or talk to somebody or go into the workplace or anything like that, it's not going to be very, very helpful for them in terms of their mental health and their overall well-being. And I think there's actually an issue here and a huge concern that we really need to look at. I can understand your point. It's been good for some people being able to working from home. And, parents, I think, single moms, I think is a fantastic idea. And I think going beyond COVID, I think the government does need to look at that, because I think that's one of the issues that I think think maybe I'm going off a little bit, but I think that's one of the issues, could solve some of the young feral youth issues that we have in this country in terms of crime, that sort of thing. I think that might help in terms of getting young parents to be able to work from home. But that's probably could be as a result of COVID in the long term. But in the immediate effect, we need to look at how people are actually dealing with COVID and how they'll be able to, the fact that they have to work on their own and stay on their own, how that affect their mental health.
I mean, there's something the minister in Jamaica said, Minister Tufton, and I believe the Prime Minister, by saying, okay, we're at this point now, but you got some elderly people who are at home and some people at home. Go and check them. Put on your mask, cover up yourself, go and talk to them. Keep that talking, because isolation will really affect some persons. Because I never forget this guy in Jamaica, and he said, quarantine, isolation, that's for rich people, man. I'd rather die than die at home or something hungry, The COVID come from me, So it's like, as David said, it's a balancing act. And if I bring in back Nordia Mackenzie here, if you listen to the news, everyone is dying of COVID. But if you check the statistics, it's only 6% of the people that died from the coronavirus itself without having any underlying illness. But the media is doing a beautiful job in driving fear into people. Coupled with losing their jobs, their homes, and their mental health, really have a pandemic. Now, I'm not going to try to say I'm bringing in Trump, but Trump said something about have no fear, have no fear. Let's not fear this thing. Churchill talk about we will not surrender. Is it that there needs to be some sort of brute force at the same time in confronting this whole thing psychologically? I'm just trying this out.
No, I just think we need to be honest with people. I think with Trump in particular, the first part when it was in January when he heard about it, he covered it up, And it's also with our government, Boris Johnson, he was pretty much on the back foot for the first part of it. So it really hasn't helped. We are really trying to catch up, and it makes it even worse now because we're going into the flu season and we still aren't ready. We're still trying to find solutions when really these are things that, in the developing world, we really should be able to, or developed world, if you want to put it that way, we should actually have some answers to some of these things, and we're not. And the problem is a lot of people have switched off because they're hearing one thing, and politicians and ministers are doing things completely different. So people don't even know what the truth is anymore. And the fact is, because you've lost people's interest in it, whatever they say is not going to work. Because people aren't going to listen anymore. So, where we go from here, it's going to be a very difficult one to really get people back engaged. And I think it's very much important that people are engaged in order for the government to push through some of these policies that they're trying to do.
David, I'm going to come back to you before we move from this subject. And do you think somehow that the government ministers worldwide are really battling with something for it's a new thing, even though we had the initial lockdown before, and they're trying to play extra safe now, to the point whereby we're still in this zone where it is new territory. So can they be really blamed in a certain way as they are floundering in the darkness, if that's the right way, trying to solve it out?
I'm gonna try and be balanced on this. You've got the government that will have its own agenda, okay, and they're having to listen to people with health backgrounds in regards to how best to navigate a pandemic which is novel and new, okay, and that is again a problem because there's two opposing factions. Health ministers will have health professionals will have a particular idea in mind in regards to how to treat something, and the government's trying to balance that against the cost to the nation. And so I can't sit here as somebody who's on the side of the government potentially, or the side of health advisors. What I'm saying to you plainly is that I think we've just got to have and operate with a common degree of common sense when it comes to battling the virus, listening to obviously health advisors, but also listening to the government in regards to the commands that they have. So if there is a rule, and there is a rule at the moment with respecting sort of social distancing, which I believe in, then you adhere to that rule, and if you don't, you get fined. It's as simple as that. So I don't know that you could sort of blame the government for acting in the manner that it is trying to act. And indeed, the government of the UK doesn't represent the government of the world, and every government has its own ideas as to how to best proceed in regards to controlling the virus. Now, governments across the world will have a different type of people to govern. So it might well find that sort of stricter sort of controls will exist in certain parts of the world where people are a little bit more subservient, for example. But where liberties are a little bit greater, it's very difficult to shift people to adhere to strict policies. And I guess that's where fines come in, and I guess that's where discussion comes in. But it really has to be a balancing act to allow people to get out, do the things that they want to, socialize responsibly, but respecting sort of physical boundaries, etc. And I will just say one thing, touching on Keisha's point in regards to mental health. I think a lot has already been said from Age UK in regards to loneliness of people over 75 in the UK. There's at least 1 million people who don't have contact with somebody over the course of a month, and that's a big thing, at least the depression. And we all have our stories. Someone touched on stories from Jamaicans, but I see patients who come in on a regular basis who will tell me that they're worried about COVID virus, and they're worried about coming into hospital for their eye checkups, and they do feel low in mood, low in spirit, and worry that this is the way that it's going to continue, that they've not had communication with their friends and family. And actually the flip is, whilst they're worried about coming into the hospital, they're actually happy to have some kind of communication with somebody, because they're out of their comfort. And one interesting case, it was a man and woman, so they lived together, 23 years marriage, and they basically just wanted to both get out of the house, but they feel that they couldn't do that for any other reason than an eye review or a hospital appointment. So loneliness is a big thing. Lack of communication with others is a huge thing for people. And we're born, we come into this world, we communicate. That's what we do. We learn from other people's experiences, we move forward. And if you take away that aspect wholly, and have people just be in the house, I think that is a really difficult thing to traverse for some people, and that definitely will affect their health and mental well-being.
I tell you this, I saw a video. Unfortunately, I didn't get to share it, but it's on my page. It was a wedding, this guy and his wife, and during the course of the wedding, it was a surprise because the lady teach Down syndrome children, and they all came up and bringing the ring and everything like that. She was so overwhelmed because these are children, of course, have Down syndrome, and they're hugging and they're kissing. Of course, this was before COVID, and I said to myself, no, this can't continue. I just said it to myself, this whole COVID thing cannot continue. The lack of interaction with people, where people cannot hug each other, touch each other, having that social connection. I said, nah, this can't happen. But not that I have the answer to say I'm going to go ahead and break the signs, but I drew the conclusion, say we'll have to get over this. And that's what Nordia said. She said the first time she ever agreed with Donald Trump, and he said, don't fear. And I believe, who knows, maybe this thing is psychological, maybe it's attaching to the fear factor. I don't know.
No, but you're right. I mean, it will be very interesting to see what happened after all this COVID, because I find, of course, a lot of times if you go to a meeting and you go interview or anything, that you'll offer somebody a glass of water, you'll shake their hands. These days, you can't really do that, isn't it? They have to go and serve themselves. You really certainly don't shake their hands. And if in some cultures you might kiss somebody on the cheek, that sort of thing you can't do anymore. And so it'd be very, very interesting to see what continues, or if we go back to how things were after COVID. But it'll be it's already, you start beginning to see a change in people's behaviors already as a result of COVID.
Well, Keima, on that point, I'll just say something which is made me chuckle the other day. I got a gift from a patient, which is really nice, and he brought in a homemade marmalade, and I was like, oh, that would be so nice with some toast right now. And he said to me, Dr. Burton, I won't be offended if you throw it away, but I did bring this in for you. And I had to give it away because I couldn't take it because of the psychological aspects. As you say, you wouldn't have I wouldn't have really batted an eyelid beforehand in regards to a gift from a patient. But times are different, times have changed. And a lot of the societal norms that we would have had in place pre-COVID will unfortunately perish post-COVID.
Yeah, I mean, we've had that. I mean, we had somebody had a birthday and they brought in a birthday cake, and it was really weird. Everybody passed the birthday cake because it was cut, and now it has to be wrapped package individually, that sort of thing before, but no one would touch it because it's like the whole COVID thing. You just don't. Before times, a cake will go like so quickly, you won't have anything left. But now it's just not the same.
Well, we all know Silburn likes cake, so would
Well-
the cake have passed you?
Well, before we're going to talk about cake, because of certain doctor business and stuff like that, and blood pressure and everything, the cake is gone for now. So, ladies and gentlemen, that was my coping mechanism during the creep, and it's service time. But now they said, just keep the walking, leave the cake now. Keisha, what do you say before we go on to Donald Trump? We have to go on to Donald Trump and talk about the fly. Yes.
No, I absolutely agree that there's going to be changes in our social norms, how we communicate with people. I've already seen it in the schools. You Keima talk about cake. You're not allowed to take send in cakes for your your class parties anymore if your child has a birthday party. So things are going to change. There's an expectation that this will happen. We're just going to have to as a people adjust. And I think some change like this, some of it is actually positive, because before, I mean, surprisingly, when they say one way to mitigate this virus is to wash your hands, and I initially when I heard it, I'm thinking, but don't people wash their hands?
Not everybody.
You mean to tell me
Keisha.
all you have to do is wash your hands?
Not everybody, Keisha. Not everybody.
But there you go. So I suppose now that moving forward, I suppose everybody now know you gotta wash your hands. So there's some positive that come out of it.
Well, as what Nordia said, Nordia made the last point. Before the pandemic, the elders were left by their families. Now this only made it worse. They are left alone. The people that used to go to see them can't. The services that they used to look forward to as close. All human contact is gone. People need human contact, and the people that most affected is the elderly and the people who are vulnerable. My granddaughter has a heap of underlying health issues, and I'm unable to see her since March.
That's right. And I think Nadia exposed, a great truth there. And I think one of the things that we've noticed during the pandemic is, a lot of the time, the elderly have been neglected or forsaken by, their close relatives. And what we found is that the carers, or those people in the healthcare community who has been the as in step-in family member during for many, many years. And now, during this pandemic, we find people applauding for, these essential or key workers. Yeah. And people then beginning to realize, but wait a second, I need to see my grandfather or my grandparent. I need to reach out to them. But you think before the pandemic, how often were you going to visit them? Let's be honest, and so it does expose some truth. And hopefully, post the pandemic, people will begin to reflect on their life and make their relevant or necessary adjustments.
Well, David, as you rightly say, we have been saying it all the while, but we're going to keep that as always the top topic on this show. And as you've seen as well, the Prime Minister is going to start back the daily update as he did before, and I think they appointed a lady to do that. But without further ado, we got to talk about what happened yesterday. It's a worldwide thing. 26 days to go to the U.S. election. Who won the debate last night? Was it Kamala, Pence, or the fly? I don't want to go with it.
Well, I think it's the fly who won, because this morning I logged onto my computer and all I saw was fly memes. So you would have thought that these are two very intelligent people, very well seasoned. Very gifted in their ability, to articulate. And I think there were some great speakers. Both of them are great speakers. They articulate themselves very, very well. And to my surprise, I got up this morning and all you're seeing memes with flyers. I don't understand that. I would have thought that there would have been more of a breakdown as to the policies or the interaction, the debate itself, but it's just the fly. Everywhere is the fly. You just think, well, we're in 2020. We've been through, or we're going through an era that is so profound. The pandemic, and what we have in the morning is just the fly, the meme of the fly. There's no significant analysis about the view on the COVID pandemic or health issues relating to America. I mean, it's definitely the fly in far as I'm concerned. It's really surprising, but these are the times we're living in. This is social media for you. You look at everything, and you say it's the most important thing is the fly on his head. That's it.
Okay, Keima, what's your take on it? Because Keima, you're up and we're up and
Yeah, I was up. I was actually fascinated. I was actually looking forward to the debate, and this one was more important to me than the other two, the presidential debate. Obviously, you have Trump and Biden in their 70s, so it's more likely Biden could potentially be a one-time president. So a lot of people are looking to Harris and Pence to see what their take on things. To me, I can't decide who won the debate. I think overall the difference is that we got some policies. We got some insight. It's fantastic. We got some insight into social justice. They're both views on social justice, the views on the economy, the views on healthcare. And I think so they actually did tackle some topics which I think are very, very important. Obviously, some of the questions being dodged, which is some of the things that people were saying, but at least we got some substance out of it. They're both really highly intelligent speakers, advocates, and they know exactly their policies. They know the issues to heart, and they were able to articulate those to the people. Whether you decide which area, which party you support, I think it's going to be always going to come down to party. So I think the independents are still going to have a very much of a challenge in deciding who they would vote for. But I think overall, there's some things, nuggets that came out of there, which I think was very, very good.
And David, your take?
Such as?
Oh, sorry.
Oh, okay. Well, I think healthcare. I mean, COVID was a big talking point. And I think it's really good that they spend some time talking about COVID because, of course, we know Pence is the head of the COVID task force in the United States, and they've had over 1,200,000 people died or something like that.
200,000. That's the figure. 200,000.
200 people.
200,000. Let's reinforce that.
Yes, and so he had to defend his record on that. Whether he did it very well, I don't think so. But what Harris came out really strong, I think, on that subject when she was particularly saying, and that Obamacare is actually in court. Trump has taken Obamacare in court because they're trying to take that away from individuals. So that individuals now who have pre-existing conditions could no longer may not be longer entitled to health care going forward. So she was making the point in particularly that health care is actually on the ballot. So I think that was struck very, very, very closely to a lot of people. Pence spoke strongly, I believe, on terms of the economy, and I think in terms of their results, the number of jobs that they brought back to United States as a result, manufacturing jobs, and also standing up to China. So in his view, China, they've done very, very good, well, in terms of defense of America's status in the world, and not let America seen as a lightweight. And I think that's what his position on that was.
Let me hear what David take on it. David, I'm assuming you watch it. Or you're busy.
Yeah. So I didn't stay up and watch it all night because I had clinic this morning, but I did listen to it tidbits on my run this morning and on the way back this evening. So I didn't get to see it, but I heard it. And from what I heard, my heart would have wanted Kamala to do more and say that she won, but my head tells me that it was more like a draw, and in terms of the punches that were weighed in. And I thought when I spoke to you last week, I said that this vice president election would probably be a sell for who is going to become the president. I still think that's the case, but I think I was probably misspoke a little because I felt that Kamala would have done more and it would have been less like a draw but more like a win for Miss Harris, but it wasn't. I think that Pence did remarkably well. I think he excelled very well, and his background is such that he's in law, and I think I potentially underestimated his efforts in regards to how he would come across, and he came across methodical, he came across quite logical, and he was focused, and I didn't see all of those three things coming, if I was being brutally honest with you. And I think that Kamala was a little bit off, if I'm being honest. I'm not saying that she should have won hands down, but I just think she had a lot of ammunition that she could have fired. But it was a respectful contest. And I think that was the thing, and time was kept. I think the two things that I would say, and it picks up on Keima's point, which was one of the questions that was unanswered very early on, was the question about whether there was any discussion between president and vice president in regards to what happens with the two potential oldest reigning presidents of any lifetime, and they both chose to ignore to answer that question. I thought that was telling. And you know,
do you think they should have answered it? Because
Americans,
I actually agree with them. Did you think they should have answered it?
I don't know. I think this is politics. If a question is asked, then just give the answer.
No, this is politics. Maybe if the question is asked, you have to be strategic in terms of what you're going to say.
No, this is the thing. Because what people want is answers, right? We don't want politicians.
But that's not a policy question. That is to me, that's not a policy question.
Well, it is. It's an extension. It's an extension. Sorry to cut you, but it's an extension of it, because what happens during the presidency if something happens? The vice president takes over in that country.
The vice take over. Inevitably,
right, exactly.
The vice. You don't need to tell. I mean, the point is, it's a leading question, because it's leading into. Can you give us or reveal a little bit about the person's health? And I think that's what to me, that's what I get from the questioning, and that's why I probably would have. If I was in their position, I wouldn't have answered that question.
I think the answer that Kamala gave was probably better than the answer that Pence gave. Pence didn't really have to give an answer because he's already been the vice president. What Harris gave was an answer to say, look, I've got the credentials to potentially be a president in making. And that's where I think it was a good answer. But at the same time, it didn't really answer the question. And all that, you know, that's what I was saying. I think for the UK, it's a bit different. We obviously have somebody in a different clout. We don't have a vice president, so nobody really assumes that role. But this is different, and I think that will be telling on the minds of Americans that they chose not to answer that particular question. And I get this is politics, so you can just spin it, but I don't think that's what people want to hear. We wanted to hear the answer to the question, and it does serve what happens going down the line as well.
But what I love to hear from is persons. I've seen some comments here, which I'll bring up shortly, from persons online and also on Instagram as well. Hi guys over there. I believe personally that the last debate, the loser was America in the last debate with Trump and Biden. In this one, I believe the winner was the American people, whereby they were able to see a level of flair that I was impressed by. Even the last little child who wrote that thing, and Pence responded by saying, listen, what you're seeing now, at the end of the day, we're civil after. And that's a fact. Civil, except with Trump, because Trump don't have the other presidents. and Kamala responded saying, you're the future. But also something else about debate, which we need to also acknowledge, is that with a debate, you're asked a question, but you have a right to answer it as how you want to answer it. And that is why I like what Biden did, Pence did. When Pence wanted to go back to deal with Kamala, he just shut up. And then when the lady asked him, can you answer this particular question? I said, I want to go back. So he's got a 2 minute now to just go back and deal with her on that particular. And Kamala picked up on that as well. I said, no. I want to go back and defend my record because he actually challenged my record. And the moderator, now the question is this, what's your take with this moderator and the previous moderator?
Well, if I could comment first on that point where Kamala said, I wanted to defend my record. I don't think her response was strong enough. This was where Pence was challenging her as a state prosecutor, where she sent a lot of Black people to prison. And I think that Pence, to me, scored some really good points on that one, because he came across very, very strong. I think that was a really, really good point that he actually managed to score there. But that's my take on that. That one.
I'm speaking. I want to say that today, you know. I'm speaking. And the memo which is going around now is Claire Huxley, Bill Cosby wife.
Oh yes.
That look. So Kamala have these different look. And notice she did not say nothing about her father. And Jamaicans, I believe, at home are saying, "Oh, she still haven't said anything about her father."
But
stuff.
Silver, that is a very good point, because Keima and I were having a debate or discussion, I should say, earlier today, and I just thought, I'm saying to Keima, I don't understand why she needed to talk about her father. She clearly, the first thing she said, that I am a woman of color and I'm a Black woman. That's it. Why do you think that she had to have a paragraph about explaining the details of her background? And Keima, obviously, I don't know if you still hold the vote, Keima, but you saw that was necessary. I don't really understand why she had to say, "Oh, by the way, I was born in the US, but my father is from Jamaica, and which makes me Jamaican." Why is that relevant?
She said she's a Black woman, and we know the only reason why she's a Black woman because her father is a Black man. So I think she should have actually qualified that in the same sentence where she said her mom came from South Asian. She should have said her father is from Jamaica. I can't see why she couldn't have said that. I mean, I don't know why there was an omission. That's what I'm saying.
But anyway, I can say George Robertson say, I agree with you 100%, Miss Allen. Damn the fly. You know, it's interesting that lots of people take away from it was it's hard to win when you're trying to defend the indefensible. George Roberts, is that the fly or is that Kamala? I don't know which one we're talking about there, because according to some punters, they say Pence won, the fly second, Kamala taking up the rear.
No, I think there's a draw there, but there's a point here. The Nadia mentioned about the angry Black woman stereotype. Those memes that I've seen around with all those little images of Kamala's facial expressions really does concern me. And I don't know why, honestly, I don't know why people do that, because it's only fuel the same sort of stereotype that people have of Black women, like they're having that look, not saying, but that look, but they really doing it. Do we really need to be doing that?
I mean, when she's lying, I'm sorry. The bit about what do you call it? Franking, yeah. Fracking. And Pence call her out and she's like, the way she's doing like this. When she's lying, I'm not saying she's lying, of course, guys. I'm not even she's lying. When Pence lie, the fly comes. You know what I'm saying? Maybe.
Because he's talking something.
That fly was there on Obama a few years ago. You remember when Obama
really
had a fly on his hands?
Yes, yeah. But at least Obama noticed that there was a fly. I don't understand. He didn't notice there was a fly.
Maybe it was his mate, as David said.
He could have done this bam on his head like that.
Well, the only other thing I would say is that the only fractious point I pick up is the bit about systemic sort of racism within the police. I think there was a big difference between the two approaches there, and I found that very interesting as well, because obviously Kamala was saying there needs to be social justice, which there does, and so Pence was defending the police and the judicial system, and then putting Kamala in the middle of it and saying, "Look, you were a prosecutor, you're part of this as well." So to speak. So I think it was very difficult for her to try and navigate that. And I was quite happy for the moderator to move on to the next question, because it was kind of hot water for her. But I do think being a critique, I think she could have done more with regards to the coronavirus point. I kind of disagree a little bit with Keima in that regard, because she had all the aces, she had the 200,000, she had the response, she knew exactly what happened in regards to the start of this, and I think she could have put a couple of more nails in the coffin politically, but essentially she didn't, and we move forward.
Yeah, but I think Pence, being a smooth operator as he is,
he
was able to navigate, because I can't see with that record how you could even defend it.
Exactly.
But for some reason,
he slipped out of it. He slipped out of it, and then I think at one point, you can correct me if I'm wrong, but he kind of didn't answer a question and said that that essentially she was mocking the American people's response to the pandemic,
yes.
and I thought that wasn't even what she said. But it sounded so smooth.
Exactly.
It sounded so smooth. I was just like, wow, I can't believe she's doing this. And then I thought, no, I'm on my run. I'm going to rewind this again. And I was like, but that's not what she said. She didn't say
blatant,
that.
right in front of everybody.
Well, as you're winning, you just hear the words, and you're like, wow, Kamala, you did not do right by offending the American people and not defending them.
I said to Keima, because we're of late, and I said to Keima, oh my days, man. I think Vice President Pence has swept me off my feet, man. He was like,
He's
yeah,
smooth.
yeah.
He's smooth. He's lyrical. He waxes lyrical, and he's calm with it as well. I think that's the thing.
Very
He's very
measured. That's the
calm.
thing.
That's
Very
it, measured,
measured. Very
meticulous.
The thing
calculated.
is,
Very
Yes.
meticulous.
You talked about surgeons a few weeks ago in terms of surgical proficiency. I don't think Trump's in his league in that regard. Trump is more, vociferous. He hammers it out. He says what he wants to. This guy is meticulous. If I wanted somebody to do my surgery, I'd pick Trump. I'd pick Pence over Trump.
I drew this conclusion.
Which is what
the strength of Kamala, no, the weakness of Kamala is Biden, and the strength of Biden is Kamala.
I think. Can you not say the same for Pence and Trump? Because
Strength of Trump. No, the strength of Trump is Trump.
no, because
Anybody.
and the reason I say that though, listen, when Trump speak, right? When Trump speak, nobody want to hear him because he lashes out. He's loud. He's just not something that he's boisterous. Nobody want to hear him. He's just frustrating. But then you have what you see last night is Pence articulating the same thing as Trump. Sorry, Pence articulating Trump in a very sophisticated way. And
Keisha,
you had no chance but to listen.
I think they're both.
They cut from the same cloth.
Yeah,
You just say.
I agree.
You
I
know
think
when
they're
you
both. Yeah. I was going to say, I think they both complement each other. Biden is complemented by Harris, and Pence complements Trump because Pence kind of toes the line, and he sounds very center ground. So he's going to appeal to both left and right. To be honest with you, if I'm being honest, the people, the swing voters. I think that Kamala kind of dampens down the Joe that is very very sleepy and all the rest that will hopefully help with the Democrats. But I did underestimate, the Pence effect. So I'm quite happy there's no more vice presidential debates, and hopefully Trump can sort himself out.
Well, the big thing is going to happen now is that news just came in that there's going to be virtual debate for the president. Of course, everybody's trying to get away from this COVID geezer. Trump said, I'm not dealing with that, man, because what they're worried that is Biden's going to have these placards in front of him where you can read everything, and Trump they don't want that, But it's going to be very pressing. 26 days before. Sorry, Keima.
No, I'm just thinking, and David probably come on this, but it's the fact that Trump has been to hospital and meant to be quarantined, but came out and waving like some sort of king. And then went back to the White House, and he's having speeches without mask, and he just seems to do his own thing. And with a record of how many 200 odd people dying,
200,000. No, I feel I need to drive it home. It is shocking. It's a shocking number, and he all he says, "Have no fear, have no fear." 200,000 people died under your leadership.
It's so true.
Yeah.
Well, anyway, we see what happens unfold. What do you think? What's your prediction for the election, though, based on the start?
I was more leaning towards Joe and Harris ticket. I'm leaning towards that as a ticket, but I think, Hart says.
You want them to.
Says, yeah, I do. I want to change in direction. I do want there to be more unification across the globe, and I think that the US is still seen as a global leader. I don't want isolationism, which is what I see more so with the direction of travel that they currently have. Again, another little tidbit or discussion was the fact that they were talking about sort of NATO and possible isolationism away from what we currently hold, and I don't think that's a positive direction. But my head now is saying a little bit more even. Okay, it looks a little bit more even than it was just a week or two ago. But still 27 days, as you said. A lot can happen. 2 more presidential debates. We'll see whether they're both virtual. One's virtual or not virtual, or one attends or not doesn't attend. But the gap, I think, has narrowed slightly.
And Keisha?
Well, again, just like David, I ideally I'd like Biden and and Kamala to win, but I don't think that's going to happen now.
Biden and Kamala. Okay, sorry, Biden and Kamala. Sorry, yeah, I got it.
Sorry,
They said Pence and Kamala to win.
no, you're confusing me.
I'm confused.
It's Biden
and the fly as
Kamala.
well. And the fly, you want the fly to win too.
And the flag.
and the fly as well. No, but so ideally, yeah, I agree completely with David. But what I saw last night, I don't think either party did could manage to swear any votes. It seems to me that they've already the supporters. I think they just they target they support their own base. They haven't actually. I can't see a new group of people being swayed to either part. You know, so I still sense what I believe will happen inevitably. Is again a Pence and Trump win, clearly, because I don't think Kamala did enough to sway any of the supporters to the Democrat direction. So I think for that, and I think that's why last night was so significant to me, because that should have been as David said, she should have tipped the balance there. She should have actually come in with a very drive home with a strong position and give people that all moment and change and captivate people, but that didn't happen. And because of that, I think it's inevitable now that it's clear run for Trump.
Okay, Keima.
Yeah, the big debate they talked about yesterday was the Supreme Court justice, and Pence was quite clear. He says they're going to win, so it doesn't matter what the Democrats say, they will win. And I'm nervous about that. I mean, of course, we had Hillary before, and there was CNN and a lot of the mainstream medias were pretty much pushing for Hillary, and we got a shock of our life. And I think, CNN now is saying that that Biden has 11 points lead ahead of Trump. So I'm really, really nervous about what it would look like. I'm hoping that, of course, we have a shift in power, and I'm hoping that Biden and Harris will take it, because I think, of course, the world is a little bit more, it's tired of what we're seeing. We need America to begin to take the leadership around the world, and I don't think isolationism is working. I think we need a strong power to lead the world, and I think the message that I'm coming out from Harris and Biden would be that what we're looking for the rest of the world. Whether American people choose that, or they kind of feel that we had enough of the wars and NATO not paying their fair share and prefer to go with and Trump and Pence, we will see.
Okay. Well, listen, guys. I know time is upon us, and I knew this was going to happen because of this. But 12 years slave. I don't know if you guys saw that bit there about 12 years of slave PUREGYM workout program. Did you see that? You know about anything about that?
Yeah.
Disappointing.
Yeah.
Disappointing by what? The gentleman or by the gym?
I think what we've got to work out here is essentially how information gets disseminated. And I know we live in a different world to say 10, 15 years ago, where it was very difficult to have an email, say, for example, that would be published on a page somewhere and for everybody to get attention and grab it. It's very easy just to click a button and have something pushed onto social media. But at the same time, there's got to be processes in place to ratify things before they become the voice or the spokes symbol for an organization. And in this instance, I think it's ridiculous that you would have something like that is pushed out into social domain for people to observe and view, and not look at it and think that this is completely and wholly racist. Despite an apology, I just don't get how you have that as something that you can do in today's day and age. Where was the vetting process? Where was the common sense in all of this? Let's just fall back for a second and think about who looked at this and thought, yep, this is a great idea to be able to put on social media and to have as something that would represent a company. And I think that's my question to PUREGYM and its managerial team. Where was that leadership in that regard?
There's something which I saw, and I just want to read this with what the young gentleman said, Mr. Simpson. He said it was ill judged, which I'm responsible for, and added, I'm a proud black man wanting to bring his history together with his passion and profession. That's what he said. His history with his passion and profession. And he went further and said, slavery was hard, and so is this. The twist to this: one rep of your first exercise, second of the second. But before you move on to the third exercise, which is also the third reps, you must start at the beginning and to move on. That's entire workout goals. During Black History Month, ladies and gentlemen, everybody's always trying to find something to say Black history. I mean, I'm even saying to a guy tomorrow, say, let's talk about insurance and Black history. Next week, I'm going to talk about Black history and the food we eat. So is it that this guy just really misinterpret some of the historical, and it could be a lack of the teaching of history in the UK for him to really feel that it was okay to do that? I don't know. I think he's out in the right place. I'm not going to use the black guy.
Yeah, I think I know what he was trying to do, and forgive me, David and Keima, for saying this. I mean, what he did is inexcusable. I take that, but I think I have an idea what he was trying to do, and hear me out for a moment. At least my thought process, anyway. So the idea.
I'm speaking.
Do I need a glass of wine listening to this, because it's going to do my head in? But go for it.
Bear with me with this thought, okay? So we have 12 years of slave, and he's thinking, okay, this is Black History Month, and as a reminder to everybody, think about what happened with the slave trade and so on. And at the same time, he has a business to promote, right? Now, which is a gym fitness business. Now, here's a thought. Now, so he decided, let me see if I could just merge the two, right? And by merging the two, what we have now is it's almost like slave away on the treadmill. Slave away. If you hear this idea of you've got to go in the treadmill and actually slave your way, slave your way to get to lose weight. So this is what I think he was trying to create, and what happened is, I know, sorry, David, I'm trying to work. I'm trying to help him. I'm trying to work out how he get to this place, and so I'm trying to think logically. He must have thought Black History Month, slave your way on the on the treadmill. I've got an idea. Brilliant. Let's bring it together and have. Okay, David, you're gone.
Listen, Keisha. Slavery is no joke, right? Slavery, I mean, we've got human trafficking, we have modern day slavery, but we had the Atlantic slave trade, yeah? People were thrown over the ships and died as a result. How do you manage to fathom that you could trivialize the whole slavery experience and history and to sort of market it in a way to get people to, come to your gym? It does.
I'm a slave for you. That's a popular song, isn't it? There's a lot of songs where they bring the connotation of slavery, as in, take control of me and take advantage.
But this is specifically about people. This is specifically about a human race and the whole, horrific experience that they've been through. And for a black man to do that is disgraceful. He needs to have some history lessons. He needs to have some history lessons if he's going to trivialize that experience to the level of trying to market it, slavery in such a way to make it almost as if, you could just come to the gym. It's absolutely despicable that he could even think that.
Okay, well,
that's my thought on it.
Notice my approach wasn't to attack the man. Okay, my approach was to say, well, from an organizational point of view, how can you have information that's disseminated in that particular manner? Where is the vetting process? Because if you can have one person that just shoots something like that out and nobody's looking at it and saying, actually, is this the right thing to be putting out? And maybe there was a vetting process. I'm assuming that there probably wasn't, but I don't think that there was, given the actual furor that came out and the apologies that came out from the higher hierarchy. So I just don't get it. I don't get his process. I don't get his thought process. I'm struggling. I like the attempt at a description there, Keisha. I'm happy with it.
Yeah, David. And I'm a big fan of representation in the workplace, and the reason why I specifically target him is because I think if you're in the workplace as a black person, person of color or race or whatever it is, you're there because you've got a voice. And if you think this is acceptable, what do you think your other colleagues, that's not from your background will think? Do you see what I'm saying? And I think we have a position of responsibility when we do these things in the workplace or anywhere. And I think for him to do such a thing is sending an absolutely wrong message across the board, and trivializing something as deep-seated and hurtful as this. Because people, you could trace your history of slavery. People are still doing that. You could trace your history of slave trade as of today, and we're still talking about reparations and compensation and the historic legacy of slavery. And we are nowhere near having those conversations that we need to compensate people for the trauma that there's been through as a result of it, and to minimize the situation to the level of some sort of marketing ploy. It's disrespectful and very disgraceful, and he needs to have some sort of history lesson, if that's the way I see it.
So therefore, Keima, what you're saying is there's that need for history lessons, Black history, to be taught properly in the UK, so people understand what really this is about. And at the same time, his mates, his white colleagues. I mean, I went to PUREGYM. I used to go to PUREGYM in Staffordshire, I believe. Was that where? And it was great. My trainer was a white guy. I mean, he made it clear as well. Said don't demonize the gym because of his action. And I think we want to agree with that as well.
He was just trying to slave his way on the treadmill. That's all.
Oh God.
Well, there's a song also with the slave song. Britain, we shall not be slaves again. Rule Britannia. Well, just want to leave that one there.
Jeez.
Like the song, Rule Britannia, England, Britain, we shall not be slaves anymore. Oh, okay. But guys, listen. There's much more we could talk about. But Black history, is it any news or any? I wanted to ask this question, and ladies and gentlemen, if is there any new information, any surprise thing about Black history that you didn't know? Is there anything David, that you want to share?
I could do a guess who. You could do a guess who for this next one. So this is somebody who is alive currently, and I think we look at Black history as history. Let's look at Black current history. So a guess who. So this person was born in Detroit, Michigan, in 1951. September 18th. He's a neurosurgeon, world-renowned neurosurgeon, politician as well, and the first person to perform successful separation of conjoined twins.
What's his name? It's not Herman Cain. It's the other guy, Keisha.
Yeah, he's a Republican guy.
He's a master.
The Republican.
Yeah.
What's the other Republican guy?
He's a master in his field of neurosurgery.
Let's see if anybody can guess it from the online.
The author of a book called Gifted Hands. This is one of the first medical textbooks that I read. Oh, it's not a textbook, biographies that I read.
And he's a Seventh-day Adventist.
He is, I think, a Seventh-day Adventist.
I know you, so I can't get his name though. Oh my goodness.
Well, he went to Yale University. He received a bachelor's degree in psychology in 1973. And then he did some fellowships. He went to Queen's Elizabeth Medical Center, and then became the director of pediatric neurosurgery at Johns Hopkins. Johns Hopkins is one of the biggest hospitals in the world. And then he took a turn from his medical sort of positions to, as you said, become a lead in the Republican Party. Of course, I'm talking about Ben Carson. Ben Carson, and he's responsible for the policies regarding housing for Trump. So that's where he's at the moment. So I knew I couldn't get his name. Oh my goodness. There you go. So that's who I think I will reflect on, and I think I reflect on him because it was one of the first books I read before going into medicine. I knew I wanted to do medicine, and I think he was a positive influence on my direction in life. And I still think he should be listened to. I still think that he has a big role to play in terms of encouraging people into medicine that may well have not thought about medicine as a career choice, and he has a lot to say in that regard, I'm sure. And I think a lot of firsts there. Being the first person to separate conjoined twins successfully, that's a big thing. That's a real huge thing. And so I think he's a credit to the medical profession, and he's a credit to the Black community as well.
That's great, and that's very powerful, David. And one of the things I always say when it comes on to Black figures, prominent figures, sometimes we demonize them sometimes because of their religion, their race, not their race, but their policies, their politics. When they were going through that stage, when they made it, we all behind them and we all supported them. And it's interesting, David said, you gave that sort of voice, even though, he's still, one is saying that because, of course, he's in Trump camp. And many people don't like when Black people are associated with Trump. So they demonize them and they ostracize them and they call them all these different names. And I think that is something as Black people we should stop doing as well. We need to accept them and recognize that we all have differences. So I'm glad you stepped out there, David, and you went into the fire then. with that one. Keisha, Keima, anyone?
Next week will be my turn. I'll come up with something next week.
Fantastic. Keisha?
Well, I think I'll wait for next week as well. There's too many in my mind at the moment, but yeah.
We've got 3 more weeks of Black History Month. We can continue this for the whole year.
Okay, and before we go, let's your Nordium. I can just say I'm going to draw something to you guys out of the Bible when the Israelites were in the wilderness for 40 years. Before they get into the promised land, years later, when they turned their back on God, they did so because they couldn't understand or knew what their foreparents went through. It is the same thing now with slavery, because this generation can't comprehend what happened during the time when our foreparents were enslaved. We laugh and behave as if it didn't happen or it wasn't. Tonight was very informative and interesting. Don't join in most times as I work night. Take care, guys. It was great interacting with you all. I have a shift in the morning.
But that's powerful. That is really powerful. I like the link or the correlation there. That is really powerful.
Yeah, thank you very much for that. And tomorrow night, as a matter of fact, I'm going to be talking to an insurance guy, Corey Whitley. He's from Jamaica, and we're talking about Black history and insurance. But it's not going to come in from like why insurance is not being taken up in the Black community or the history of insurance. We're going to talk about why insurance is important to protect our legacy, to protect the history, to ensure that we have something when your parents or someone pass away. Because what he said is that he's finding a lot of GoFundMe happening when people die and they're going on Facebook asking for help with their funeral expenses. Many people say as well that people find it hard to pay that little extra for securing their children future. A lady I was listening to in Jamaica, she said she sometimes, as an insurance agent, sometimes she pays the premium for someone who sometimes, I say, she's not saying people should do it, but one day she did it, and the next day she got a call from the lady's phone saying, hi, I think it was the lady saying she paid it, only to learn that it was the sister saying the lady died. Right? What about it is that she said she was sad, but she was happy. Sad that the lady died, but happy that she had her insurance so she can take care of her children and pay off all those things. And taking care of her mother as well. So she said she don't like the news, but she's glad at the same time that that lady was protected. So it's something we're going to talk about tomorrow, about wills and everything like that.
Yeah, I agree, SYLBOURNE. Again, my experience in probate law, so that's quite interesting. I look forward for tomorrow. I think one of the taboo that within our Black communities, that when it comes to death or preparing for, if someone wants to pass away in your family, there seems to be a lack of preparation around that, and I think so. It's so important to have that conversation.
Yeah.
So tomorrow would be a great deal.
Okay, David. Good night. Any last word?
Last words. Support me. GoFund. It was GoFund actually. It's Run the Month. So if you type in runthemonth.prostatecanceruk.org/fundraising/David-Burton20. I'm running for Prostate Cancer UK this month. I'm trying to run cumulatively 50 miles for the month. If I meet a target of just 125 pounds in 2 weeks, then I'll extend that to 75 miles for the month.
Oh,
So
well, you're going to meet that target, isn't it, Keima? If one of us give £25, you're actually halfway there already.
Yes,
Almost there.
boom, there we go. I'll take that, take that, take that. So I will extend that up. I'm going to be doing on my GoFund or my Run the Month page a daily update as well. So please support me on this journey of supporting Prostate Cancer UK and the good research that they're doing in order to try and get to grips with this debilitating condition. And later on this month, we hope to run a webinar through Jamaica Diaspora UK, a shameless plug, on prostate cancer. So please support me.
And that is correct what I put up there. Run them on Prostate Cancer UK. That's the information I took up a while ago from what.
Yes, that's the one. Thank you very much.
There so people can do that. So, ladies and gentlemen, let's David get that in the next 1 hour, so we can get that done.
And then I get after you're pushing me from 50 to 75 miles in a month. That's a lot of miles.
Yep.
We can get that.
I like to challenge people. So yeah.
And then we can get a train. We can get a train. You got a train door name in your honor.
There you go. That's what I want. You know,
the gentleman there. What's his name? The elderly gentleman who was reading some fantastic stuff.
Oh yeah.
Listen, ladies and gentlemen, I want to thank you so much for tonight. Those on Instagram. We're not going to do our Instagram thing tonight because I've got court in the morning as well. but thank you, everyone, and we look forward to next week. Remember, this Saturday, tomorrow, we have Corey Whitley talking about insurance. Next week, we're going to be talking about the food that we eat. David, same thing about diabetic, and all those sort
very good.
The prostate and what is good for. Why? Somebody said to me, do you know that yam was called slave food? I rest that right there. There's so many history regarding the food that we eat as well. And then I'm going to do a show at the end of the month, and it's going to be, I'm talking about with Chris Brown, why when we talk about Black history and certain movies affect us differently. Some will want to watch Roots, and some say, I can't take watching Roots. Some want to watch 12 Years a Slave. Why are we talking Black history? Why are we talking this? And some get angry. I never forget Angela Moore, which was on my program, and she said, Silver, when Roots came out, a lot of us went back to school the next day, and we said to our white friends, Mary, can you just leave me for a week, please? We're friends, but I'm going through something right now. I heard that it affected people in the UK big time. You know what I mean? So, Jane, I know we're good mates, man, but just
step off for a little while. Just step off for a little while. I need my space.
Yeah, just give me my space. So, we're going to talk about that as to why it affects persons differently, as well. So, without further ado, guys, have a good night.
Thank you.
Good night.
Ladies and gentlemen,
Bye-bye.
Thank you so much, Lorna and Nardia. Thank you for all of that. And George and Instagram as well. Thank you so much. Thank you. Remember to like, subscribe to the SYLBOURNE Show now. And, peace out and all.